Welcome to Roadmap to Residency. Hello everyone, I am Abhiraz. Welcome to our Club 250 Matchmaker sessions. We will be running through some questions with you guys to help you on a journey to a 250. So here we have one more question. So which of the following is the most likely explanation for this patient's amenorrhea? 38-year-old woman comes to the office due to breast tenderness and absence of menstrual periods over the last 3 months. The patient has a history of schizophrenia and familial hypercholesterolemia. Medications include risperidone, which has led to significant improvement in psychotic symptoms, and atorvastatin. BMI is 26 kg per meter square, down from 30 kg per meter square 6 months ago, and after following a strict dietary plan. Basic serum chemistry panel and thyroid function test are normal, and urine pregnancy test is negative. Which of the following is the most likely explanation for this patient's amenorrhea? 21 hydroxylase deficiency, Asherman syndrome, drug-induced amenorrhea, polycystic ovarian syndrome, primary ovarian insufficiency, or weight loss. So here we have some figure from your endocrine part. So I can see that dopamine inhibits prolactin, okay, and prolactin, you know all about the symptoms of the functions of the prolactin as we have discussed in our endocrine part. So the antipsychotics and antidepressants, they all just inhibit the dopamine, so that prolactin secretion is increased. Okay, now whenever there is increased prolactin secretion, okay, there is amenorrhea, right? So dopamine inhibits the prolactin secretion. When dopamine is inhibited, prolactin secretion is increased, and increased prolactin will show its effect. So this patient with amenorrhea and breast tenderness likely has drug-induced hyperprolactinemia due to risperidone, which is an antipsychotic drug used in the management of schizophrenia. Its primary action is to inhibit dopamine D2 receptors, but it also has inhibitory effects on serotonergic and alpha-adrenergic pathways. Secretion of prolactin from the anterior pituitary is primarily regulated by the inhibitory effect of hypothalamic dopamine. Stimulation of D2 receptors on lactotropes decreases the synthesis and release of prolactin. Because risperidone and other antipsychotic drugs block the D2 receptor activation, there is a loss of the normal tonic inhibition of prolactin release, like I have told you earlier, leading to hyperprolactinemia in some cases, like in a patient. And this can result in galacturia and breast soreness. In addition, elevated prolactin levels inhibit the release of GnRH from the hypothalamus, resulting in central hypogonadism and amenorrhea. So here are some side effects of first generation antipsychotics, like low potency, which are non-neurological, like chlorpromazine and thioridazine. Side effects are sedation due to histaminergic blockade, anticholinergic side effects, and orthostatic hypotension. Also, there are some high potency drugs like haloperidol and fluphenazine, which can cause extrapyramidal symptoms like acute dystonia, akathisia, and Parkinsonism-like symptoms. These are some important antipsychotic side effects that you all need to remember and is frequently tested in the examination. There are some extrapyramidal side effects like acute dystonic reaction. Whenever you start antipsychotic medications, these symptoms can appear first, even before the effect of the medication, even before the positive effect of the medication. So there's some acute dystonic reaction, which can be sudden onset, and they have sustained muscle contractions. Akathisia can lead to subjective restlessness with inability to sit still, and drug-induced Parkinsonism, leading to tremor, rigidity, bradykinesia, and masked faces. Bradykinesia lead to involuntary movements after chronic use, example, lip smacking and choreo-attitude movements. Neuroleptic malignant syndrome causes fever, rigidity, mental status changes, and autonomic instability. Let's discuss something about schizophrenia. This text is from your first aid. So, schizophrenia is a chronic illness causing profound functional impairment. The symptom categories include positive, negative, and cognitive symptoms. So, the positive symptoms mean exaggerated normal activity or excessive or distorted functioning. Example, hallucinations, delusions, unusual thought processes, disorganized speech, and bizarre behavior. Negative symptoms may be diminished functioning, example flat or blunted effect, apathy, anhedonia, alogia, or social withdrawal. Cognitive behavior problems may be reduced ability to understand or make plans, diminished working memory, or inattention. So it can be associated with altered dopaminergic activity, increase serotonergic activity, and decrease dendritic branching. So this dopaminergic and serotonergic involvement is important to remember in case of schizophrenia. Ventriculomegaly on brain imaging may be seen. Okay, now this concept is also maybe sometimes tested. They might give you a CT scan and may ask you the diagnosis related to the symptoms. So the lifetime prevalence is 1.5% in males, okay, which is more than females. Presents earlier in males, late teens to early 20s, than in females. And there is increase in the suicide risk because the patient have hallucinations. And whenever you have command hallucinations, there is increased risk of suicide. Heavy cannabis use in adolescents is associated with increased incidence and worsened course of psychotic, mood, and anxiety disorders. So the diagnosis requires more than two of the following active symptoms, including more than one symptoms from 1, 2, and 3. So if there are more than one symptoms must be present from this 1, 2, and 3, that is either delusion or hallucinations, often auditory or command hallucinations, and disorganized speech. Now, among these three, one or all must be present. And there may be some other symptoms like disorganized or catatonic behavior and negative symptoms. So symptom onset should be more than 6 months prior to diagnosis. Requires more than 1 month of active symptoms over the past 6 months. So what for the other months? So brief psychotic disorder is where there is more than one positive symptoms lasting between 1 day and 1 month. Schizophreniform disorder is more than equal to two symptoms lasting 1 to 6 months. So brief psychotic disorder, less than 1 month, 1 to 6 months schizophreniform disorder, and more than 6 months is schizophrenia. Now, there is treatment which is generally by atypical antipsychotics, example risperidone, like in our patient, which are first-line drugs. Negative symptoms often persist after treatment and despite resolution of positive symptoms. So these are the features of schizophrenia. Okay, there may be some positive symptoms like delusions, hallucinations, disorganized speech, and catatonia. Cognitive deficits like attention, memory, executive dysfunctions. Okay, negative symptoms like affective flattening, alogia, avolition, anhedonia, social withdrawal, comorbid substance abuse. Mood symptoms will be depression, hopelessness, suicidality, anxiety, agitation, and hostility. These all can affect the work, interpersonal relationship, and self-care of the patient. So talking about the schizoaffective disorder, so it shares symptoms with both schizophrenia and mood disorder or bipolar disorder. To differentiate from mood disorder psychotic features, patients must have more than equal to 2 weeks of psychotic symptoms without a manic or depressive episode. So delusional disorder is when there are more than equal to one delusions lasting more than 1 month. So delusion is an unshakable belief which are not triggered by the religious and moral values of the patient. God exists. So this is our belief. Okay, if you are an atheist, you may believe that the God doesn't exist. Okay, this is your religious belief. So it should not be about the religious and your moral values or your cultural beliefs, but other delusion, like someone is trying to kill me. So daily functioning, including socialization, may be impacted by the pathological fixed belief, but is otherwise unaffected. Can be shared by individuals in close relationships. Okay. Now, schizotypical personality disorder is when cluster A personality disorder that also falls on the schizophrenia spectrum. It may include brief psychotic episodes, example delusions that are less frequent and severe than in schizophrenia. Okay, it's just a sort of, you can say, a transient episode of schizophrenia. Now let's do one more question here. So which of the following best characterizes the positive symptoms observed in this patient? A 24-year-old woman is brought to the emergency department by her roommate due to concerning behavior. The roommate reports that the patient has been acting unusually for the past week. Now, during the interview, the patient is observed to be speaking rapidly and incoherently, frequently changing topics. She exhibits the unpredictable and bizarre movements, such as repeated grimacing and pacing around the room. The patient claims to have received special messages from the television that are guiding her actions. Which of the following best characterizes the positive symptoms observed in this patient? Apathy, social withdrawal, delusions, hallucinations, flat effect, anhedonia, disorganized speech, catatonia, emotional flatness, lack of interest. So we have discussed about the positive and negative symptoms. You may be able to answer this question. So positive symptoms in schizophrenia represent an excess or distortion of normal functioning and can include the following: delusions and hallucinations. So delusions are false beliefs that are resistant to reasoning or contrary evidence. In this case, the patient's belief in receiving special messages from the television is an example of delusion. Hallucinations are perceptual experiences without external stimuli. The patient's claim of receiving special messages can be considered an auditory hallucination. Oh, these are the symptoms of schizophrenia again. Positive symptom, hallucination, delusion. Positive disorganization symptom like disorganized speech, thought language, thought disorder like thought blocking, disorganized behavior. Negative symptoms like alogia, flat effect, poor attention, avolition, that is loss of motivation, anhedonia, that is lack of pleasure, loss of social interest, and attention deficits. Now, again, this question is testing us about the negative symptoms observed in this patient. So 30-year-old man is brought to the clinic by his family due to changes in behavior. The family reports that over the past 6 months, the patient has become increasingly socially isolated, neglectful of personal hygiene, and emotionally indifferent. He rarely initiates conversations and spends most of his time in his room engaged in repetitive activities. The patient denies feeling pleasure in activities he once enjoyed and appears indifferent to his family concerns. Which of the following best characterizes the negative symptoms observed in this patient? Disorganized speech, catatonia, delusions, hallucinations, apathy, social withdrawal, flat effect, anhedonia, rapid speech, or unpredictable movement. So negative symptoms here is apathy and social withdrawal. So apathy refers to a lack of interest or motivation, and the patient's indifference to family concerns and diminished pleasure in activities are indicative of apathy. Social withdrawal involves a decrease in the social interactions as observed in the patient spending most of his time in isolation. These are the negative symptoms again: blunted effect, alogia, avolition, asociality, or anhedonia. You can just pause the video and read the description about these. This is the schizophrenia pathogenesis clinical findings. So there may be genetic or dopamine hypothesis or other biological theories that are under consideration, which may be uh, leading to schizophrenia. The schizophrenia leading causes is due to the abnormality of neurotransmitter, mainly dopamine, transmission in various regions of the brain. Okay, if there is increased dopaminergic transmission in the mesolimbic projection, the dopaminergic neurons here project into the limbic system responsible for behavior and emotions. So there may be abnormal dopamine transmission here in thought to cause the positive symptoms of schizophrenia. So positive symptoms is due to the effect in the mesolimbic pathway. It can cause delusions, hallucinations, speech disorganization, and grossly disorganized motor behavior. But if there is decreased dopaminergic transmission in the mesocortical projection, okay, it can cause negative symptoms. Okay, so because the dopaminergic neurons here project into the cerebral cortex, okay, responsible for thinking, decision making, language, and mood. And abnormal dopamine or decreased dopamine in this area can lead to negative symptoms. I hope that now this is clear. Again, repeating, positive symptoms is due to increased dopamine in mesolimbic pathway. Negative symptoms is due to decreased dopamine in the mesocortical pathway. Now let's do one more question here. So which of the following best characterizes the primary feature of delusional disorder in this patient? So a 42-year-old woman presents to the psychiatric clinic with the belief that she is a highly influential political figure and that a secret organization is conspiring against her to undermine her influence. Despite having no evidence of support to support these beliefs, she is adamant about their validity and becomes distressed when questioned. The patient's family reports that her daily functioning remains intact and she is able to maintain her job and relationship. Which of the following best describes the primary feature of delusional disorder in this patient? Disorganized speech and behavior, impaired daily functioning, apathy and emotional indifference, fixed false belief without impaired reality testing, hallucinations and perceptual disturbances. So fixed beliefs and without impaired reality testing is the primary symptom. Delusional disorder is characterized by the presence of one or more fixed false belief without the marked impairment in the reality testing seen in schizophrenia. The patient is in this scenario maintains her daily functioning, indicating that her false beliefs do not significantly interfere with her ability to work and maintain relationships. So delusions are fixed false beliefs which cannot be corrected by logic and are not consistent with culture and education of the patient, like I have told you previously. Hallucinations are the false sensory perception experienced without real external stimulus. They are usually experienced as are originated in the outside world, not within the mind as imagination. Illusions are when there is misperception of real external stimulus, most likely to occur when general level of sensory stimulation is reduced. These are the types of delusional disorders like erotomania, grandiose, jealousy, prosecutory, somatic, mixed type, and unspecific type. So erotomania is when another person, usually of higher status, is in love with the person. The person thinks so. Grandiose is when the person thinks that he has got inflated worth, power, knowledge, identity, and special relationship to deity or famous person. Jealous is when there is individual's sexual partner is unfaithful, for example. Prosecutory is being prosecuted for no apparent reason. Somatic, having some physical defect or general medical condition. Mixed type, more than one type with no predominant theme. Now let's do one more question here. So which of the following best characterizes the primary feature of schizophreniform disorder in this patient? A 28-year-old man is brought to the emergency department by his friends due to recent changes in behavior. He has been exhibiting disorganized speech, disorganized behavior, and flat affect over the past month. The friends report that he has become increasingly socially isolated and neglectful of personal hygiene. The patient has denies experiencing hallucinations and delusions, and there is no apparent impairment in his occupational or social functioning. Which of the following best describes the primary feature of schizophrenic disorder in this patient? Impaired occupational and social functioning, disorganized speech, disorganized behavior, presence of hallucinations and delusions, neglect of personal hygiene, persistent symptoms for at least 6 months. So disorganized speech and disorganized behavior. Schizophrenic disorder is characterized by the presence of two or more uh, of the following symptoms: disorganized speech, disorganized behavior, flat or inappropriate affect, and hallucinations and delusions. Unlike schizophrenia, schizophrenic disorder is distinguished by a duration of symptoms lasting at least 1 month but less than 6 months. So this is schizophrenic disorder, 1 to 6 months, outcome return to baseline, continue for more than 6 months, then it can become schizophrenia. Thank you for watching. Keep studying hard.